Good afternoon, everybody. Christine Barconi here in our NBC4i streaming studio. This is a big month for us. We have surpassed 6 months of living with COVID-19. So much has happened, but it might feel like it's gone by in the blink of an eye. But today we're doing the show to talk about these past 6 months and also where we're headed in the future. We'll have lots of people to talk to today, including Columbus Health Commissioner Dr. Mashika Roberts, as well as NBC4 data journalist Ben Orner, as well as our State House reporter Adrian Robbins. But first, we are going to start with our special guest, Governor Mike DeWine. Thank you so much for joining us from your home in Cedarville. Thank you for being with us today. How are you doing, Governor? So over these past 6 months, I kind of want to start with a humanizing question. You probably haven't been able to see a lot of your grandkids over the past 6 months, haven't been able to hug them, haven't been able to hang out with them. Have you ever, like a lot of us, thought about throwing in the towel and saying, hey, you know what? I want to hug them. I want to hang out with them. I'm done with all of this.
Other grandkids. I mean, again, we see them some. We Skype back and forth with them and FaceTime with them, but it's not the same. And so, yeah, it's probably for Fran and for me. That's the biggest burden of this. And look, I know people have had great tragedies. Some people have lost loved ones. Some people have gone through COVID and suffered through it. So I'm not trying to say our sacrifice has been great, but that's what's tough for Fran and for me.
It might not be as great as losing a loved one, but it's certainly the most personal one and something that we all have dealt with. So looking back in March, I mean, as of tomorrow, I don't know if you can believe this or not, but 6 months ago, tomorrow is the day the Arnold Expo was canceled. Um, I know. Looking back at
It's hard to believe.
It is. Looking back at that, what was the specific piece, or was there a specific piece of data or piece of information that you saw that made you act much earlier than other governors from across the country?
Well, I think it was Dr. Roberts and Dr. Acton. You know, Dr. Roberts was all over this and was telling the mayor and I what the problems were. Dr. Acton was as well. And that was a tough decision. It was tough because no one had done that nationwide. I mean, no big event had, to my knowledge at least, had been called off. And so when we were looking at this, we had people coming in we were told people from 80 countries, 60,000 people, at basically a trade show where they're in close proximity to each other. I mean, we just looked at that and thought this makes no sense. But no one had done that before. No one had canceled anything. And so when we canceled that, frankly, that was a very difficult decision. And I cannot believe it's been 6 months. I guess
Yeah,
I'm
6 months
shocked that
tomorrow.
it's been that long.
So it happened on March 3rd, and then we hit 100 cases on March 20th. So it took that long to get 100 cases, but just 3 days later is when we were getting 100 cases per day. When you saw those numbers start to ramp up like that, what was going through your head? Were you thinking, are we doing enough? What else can we do? What were you thinking at that point?
Well, that's a very perceptive question because, what I ask myself every day for 6 months is, are we doing enough? I'm still asking myself that question. And we constantly keep looking at things that we should be doing. So, when we made the initial decisions, we'd had virtually no cases in Ohio.
Mhm.
Um, but as you say, and the experts told us they're coming. And once they start, then they're going to multiply. And you're going to see it go out just like that. So I'm not sure we were totally surprised by what happened. But what the experts kept telling us is you're making the decisions early. It will seem like you're premature in making those decisions, but when you look back on it, it will seem like you were too slow. And that was the advice that they always gave us as we went through this. So Yeah, it was, but the Arnold decision was the first big decision. And then everything kind of, it wasn't very long till we had to deal with, okay, what are we going to do about the NCAA basketball, the
Hmm.
play-in dates in Dayton? That was coming up. Then you would go into the regional or district events, and so we had to make these decisions.
We mentioned all of these things. We have professional basketball that had to be canceled. We had the NCAA tournament, OHSAA tournaments. I was looking back at our archive, and that's kind of how I'm getting all of these dates. We had 500 some stories related to coronavirus in
Wow.
that month. So it's just insane to think about all of that. Is there anything you would have done sooner? Mask mandate, the total lockdown. Looking back, would you have done anything sooner?
Yeah, I think the mask mandate, if we'd done it earlier, it would have been better. What I was trying to gauge, and we talked about doing it, very early on, but my calculation was that people were not ready to accept that, and you can only push people so much, only lead them so much, and if they're not ready to follow, not ready to do it, and it's kind of a delicate balance of where is that point. And, when we did do it, as it's been very controversial. It still is. We still have people who, don't want to wear masks
Mm-hmm.
and think it's a badge of freedom. We try to tell them, look, the badge of freedom is wearing the mask because that enables you to do other things during the day, enables sports to occur, enables kids to play football, you know, people to play soccer, and all the different things. Our schools are open. So we look at that as a something that we're doing for freedom that gives us more freedom, but it's still controversial. So trying to pick the right date of when we could lead
Mm-hmm.
and put that mandate on. What we did see is a real change. Let's take Franklin County. I'm guessing that we were probably at 60% compliance before we put
Mm-hmm.
the mask order on. After we put the mask order, we probably hit 90%.
Yeah.
So it's made, and then what you saw after that occurred, Columbus put their own mask order on, and we put an order on statewide. What you saw after that was where people were really in compliance in our urban areas. You started seeing the cases go down,
Yeah.
and it's made a huge difference, just a huge difference.
Absolutely. I mean, I live in Columbus. I live in the Grandview area, and I kind of saw that with the 60-70% compliance. But then, even myself, I know better. I work in the media. I listen to you guys every single day. But, maybe sometimes I would just run into the gas
Sure,
station and forget it. And there's no more forgetting it. So I think that is definitely something I can personally attest to from seeing that.
it's interesting. Yeah.
Moving forward, have you discussed with county and city health officials once we do have a vaccine what distribution will look like in Ohio?
Well, we're starting through that. We're doing some, reaching out to different people in regard to that. So we hope that comes soon. We don't know when it's going to come, but yeah, the ability to uh, prioritize, and we assume that the CDC and the federal government is going to have a priority schedule. But one thing that we're working on just today is, how do we get the distribution out? Who gets it? How do you make sure that we get out distribution very quickly so that people can start getting it?
Yeah.
So we're not there yet, but we got a plan for it.
So we seem to be, from my observations, we seem to be plateauing again. While it is at a higher number, we seem to be in that area from 1,000 to 1,100. Yesterday we did have 1,400. I think that was like the sixth highest we've ever had, and the highest we've had since July. um, since we are plateauing kind of like we did in April and May, have you thought about rolling back some of the regulations, distancing in restaurants, the mask mandate, the bar curfew? Have you thought about rolling back some of that at all?
No, I mean, not now. It wouldn't make any sense. I mean, what we always felt was going to happen is when colleges went back in, when Capital, Ohio State, you know, all our Central Ohio schools go back in, and then grade schools, high schools open back up. We felt that the spread would increase, and that's what we're seeing. So, we're now headed in the wrong direction. For about 2 straight months, we were going down in the positivity numbers. We
Mhm.
were at about 6.5, kept easing down. We got a little bit below 4, 3.8. I think one day, but now we've seen it start edge back up, and we're about 4.5. So, we're going the wrong way. We've got to, frankly, figure some other ways to let a little air out of the balloon, or we don't want those numbers to get to 5 and 6 again.
I think we were talking about this morning with the universities is some of them have fall breaks. Have you guys thought about that? And once they leave potentially their bubble, at Oxford, in Columbus, in Bexley, have you thought about what's going to happen if they do head back home to see their parents, to see their grandparents, and thought about steps to make sure that they're not spreading it to, like, if they're going to a more rural area or back home to the suburbs?
Yeah. In fact, I was talking to Ohio State's president this morning about
Mm-hmm.
that. She and I were talking about specifically about that issue. And, the guidance from the White House is very clear. I mean, one of the things they said on the phone the other day is, you need to worry about Labor Day, talk to the people in your state about Labor Day. But at the same time, in regard to our colleges, what we don't want to happen is for the colleges to be open a few weeks and then close. And then all those kids who may be carrying the COVID now go back to their homes all over Ohio, all over other states, and then infect people in their homes. And so that's, how we kind of navigate that, how Ohio State navigates it and the other schools navigate it is going to be very, very important. It's not easy. So, some of the things that you would think would work are counterintuitive. For example, you could say, Ohio State goes all remote. Well, you still have a lot of people who are going to, students who are going to live off campus.
Yeah, they still have those leases.
They're probably going to stay in Columbus.
Mm-hmm.
So, and of course, that does eliminate the possibility of them going back home and infecting people back home. So it's kind of dicey no matter what the college does or the university does.
All right, Governor, I have one last question for you, and it's the burning question. What's the threshold to lifting the regulations, to getting back to normal, to enjoying a concert again, to enjoying a football stadium with student fans again? What's the threshold? What are you looking at, and what will need to happen for us to start going back to pre-COVID normal rather than the new normal?
Well, we'd have to see the numbers come down appreciably. I mean, today they were down a little bit, but they're still above 1,000 today. As you know, they got over almost close to 1,500 this week. So we don't like seeing that. It means it's going the wrong way. The positivity numbers are going up. So the most important thing we can do, the battle we're facing now, is can we keep kids in school? Can we keep sports going? Can we do all those other things that, can we keep kids in college? And so wearing the mask now, if enough people are doing it, that's going to help us do the other things that we want to do, which is keep kids in school. Life is full of trade-offs. We all make trade-offs. We all make decisions. And the decision that we make, in regard to wearing a mask, keeping a distance, those are a pain. I don't like wearing a mask, but those are relatively small things to get something bigger. And something bigger is to keep people working. Something bigger is to keep kids in school. These are really the important things that we have. And by making these small sacrifices, we increase our odds of being able to do that.
All right, Governor, thank you so much for your time today. I really appreciate it. We'll see you tomorrow at your regular press conference.
Good. Thank you very much.
All right. Thanks, Governor. All right, everybody, let me end things here with the governor, and I will chat to Dr. Mashika Roberts from Columbus Public Health. All right, so we just wrapped up things there with the governor. We will be clipping that entire thing for NBC4i.com, so you guys can re-watch it there. Joining us right now is Dr. Mashika Roberts. Thank you so much. Dr. Roberts, we actually talked a little bit about you whenever I was on with the governor. I don't know if you were listening in, but we talked about, can you believe it, tomorrow is 6 months ago that the Arnold Expo was canceled.
Wow. Yeah. It's been a long 6 months.
It's been a long 6 months, certainly. What has that 6 months been like for you, and what I guess, have you been doing to make sure that we end this, I guess, as soon as possible? And do you see an end in sight?
Well, first of all, thanks for having me.
Of course.
Look back to March when we were having those discussions about the Arnold and we made those decisions. I realized then that what we were preparing for the next several months was going to be something that myself, I had never seen in my professional career, but many of us had never experienced in our lifetime. And I think, we can say that now looking back. I mean, none of us have lived through this type of pandemic and through this type of infectious disease that's been around the world and has required cities and communities to shut down, schools to shut down, large events to shut down, and for people to have stay-at-home orders. And so that when we made those decisions back in March about the Arnold, I wasn't necessarily thinking about what the next week was going to look like. I was more concerned about the individual cases at that time that we were going to have, and obviously what we could do to control the spread in our community. And I'm very appreciative of the leadership of the governor and then ODH Director Dr. Amy Acton for helping Ohio lead the way in getting everyone to slow down, to stay at home so we could try to control the spread of this virus.
Here in Franklin County, we have seen some positive things from our numbers. What do you think the number one, or a handful of things? What do you think the difference has been as far as our numbers going down? Because we were tracking up for quite a while, and it wasn't looking good. But now we are down. And even last week, you recommended examining going back to school in the classroom.
Absolutely. So I think there's a few things that we've done well here in Franklin County, thanks to the leadership we have with Mayor Bentha here. First is the mask order. We definitely saw a decline in cases when we put the mask order in place here on July 3rd. I think the second thing I would say that we've done that has helped us, that the governor did for us, was the starting off alcohol sales at 10 o'clock. Those limiting the sales of alcohol after 10 o'clock, I think has really helped us because it's reduced the crowds in our bars and restaurants where people are in close proximity to each other and not wearing masks. And then I can't dismiss the fact that testing, I think we've done a really good job here in Franklin County of making testing readily available to individuals, especially those who are symptomatic. And that has helped because as we identify a case, not only can we isolate that individual, but we can also quarantine anyone they've been exposed to try to slow down the spread of this virus.
You're the health commissioner of Columbus, and it's a really a diverse place. That also includes Worthington, an upper middle class suburb, and then you have some of the poorest areas in the state, and then you have one of the biggest universities in the entire world under your jurisdiction. How do you balance that and make sure you're making the right decisions for everybody across the board who lies within the Columbus jurisdiction?
Well, I think first is you've got to have a lot of information. So I really rely on my partners here in this community, my hospital partners, my university partners, our community partners, to tell me what they're seeing and what they're hearing. So I think that helps. I have an awesome team that helps me every day, giving me that information and helping me make some of these tough decisions. And then just, being practical about some of the decisions we make and the services we offer to make sure they're accessible to everyone. So obviously we go to the internet for a lot of information these days. So that's one source of information, but we know not everyone has internet access. So we have to find other means to communicate. So working with community-based organizations, working with neighborhoods, working with neighbors, and just getting the information out the old-fashioned way through word of mouth, as well as the fancy, sophisticated way, whether that's news, social media, or even our website.
Yeah. So speaking about Ohio State, their positivity number is tracking up right now. And that is reflected upon Columbus's positivity rate and Columbus's numbers. Do you think if Columbus, on the Ohio advisory scale of all the counties, the different levels that we have, if Columbus goes back up into I'm trying to, a level 3 or even a level 4, do you think if that happens because of Ohio State, that it should impact kids going back to school, because they might not necessarily, of course, be interacting with these college students? So have you thought about a balance of what you'll do in that case?
Well, I think there's a few things there that we have to think about. My recommendations for the schools were just that recommendations. And I said before they entertained going back into the classroom that we needed to have 4 consecutive weeks of a downward trend in cases. We have met that mark. In those recommendations, I did not share any guidance or recommendation of when I thought they would need to pull the kids out of school. So if our numbers go up in Franklin County as a result of OSU or any other school for that matter, I have not made any recommendations at this time that would encourage or motivate the schools to have the kids go back home and learn remotely. I work with the schools. I talk to them regularly. We're trying to do what's best, not only for the schools and the students, but also the faculty and staff that are working there. And, you know, as the governor said in his press event yesterday, and we all have to acknowledge this, when we see cases in our large schools, whether it's universities or high schools, those cases in schools are a reflection of the disease activity we're seeing in our community. So we have to keep that in mind as well. We can't just point the finger to any school. We have to look at our community. And our community numbers have not been that low. Yes, they did. We did have a downward trend. You know, we had a high of 274 cases in one given day. And now we're usually seeing cases hovering around 100. So our cases had been somewhere between 50 and 60, even before OSU came back on campus.
All right. So have you talked about, once we do have a vaccine, have you guys in your team, have you guys talked about what distribution will look like, how you will get it out quickly, and who will be prioritized, and where and when this will all happen?
Absolutely. So we've had a pandemic flu plan here at Columbus Public Health for years that we have utilized in bits and pieces at times. And now more than ever, we need to utilize it. So my team has been looking at how we would distribute not only the COVID-19 vaccine, but also the seasonal flu vaccine, because we know the way that's distributed this year is going to be different than the way it was distributed in years past. I mean, in years past, so many people used to get it at their employer, at their place of employment. And many people working from home might not have that option.
Right.
So we are looking at locations. We actually have a plan in place, not only to distribute seasonal flu, but also to distribute the COVID-19 vaccine when we get it available. So we have locations. They've been secured by CPD, Columbus Police, to make sure we can have traffic control. And we're working with our hospitals as well to make sure we can all partner together to get both the flu vaccine and the COVID-19 vaccine to the public as soon as we have them available.
As flu season converges with COVID-19 before there's even a vaccination, you know, they're hoping early next year to get that out. That's the earliest I have seen. I don't know if you have seen any earlier than that. What's that going to look like for your team, as far as making sure people are getting the proper vaccinations and keeping our hospitals at a place where they are not overwhelmed?
Right. So what it looks like is making sure that the vaccine, and right now we're focused on the flu vaccine because we know when that's coming, we know when that's going to be available, and we know who should be getting the flu vaccine. So we're focused on that. And again, we're making sure that it's going to be available at neighborhood locations here at Columbus Public Health. And we're looking at some larger venues where people could go to get the flu vaccine that would be centrally located, as well as get tested for COVID-19, again, centrally located. So we will be announcing that here in the next few days of where that location would be and when individuals can get their flu vaccine. As the governor said, we're going to be relying on our federal partners to give us some guidance on the priority groups for the COVID-19 vaccine when it becomes available. And we'll be ready to push that out at the same locations where we're using the flu vaccine, as well as working with our hospital partners so they can make that available not only for their staff, but also for their patients.
All right, Dr. Roberts, thank you so much for being with us here today and for your guidance throughout all of this. We really appreciate it.
Thanks for having me.
Yeah,
and make sure everyone wears their mask.
Oh yeah, we've got mine right here. All right, thank you. All right, that was Dr. Mashika Roberts, Columbus Health Commissioner there. Next up, we're going to bring in Adrienne Robbins. She is our State House reporter who has been covering this since the very, very beginning. Adrienne is joining our Zoom call right now. She is at the State House working hard today. Adrienne, are you ready for us here?
I am.
All right, she'll be here in just a second, guys. All right, I think I see Adrian. Adrian, we're just going to talk a little bit about today what this past 6 months covering this has been like for you. I'm only seeing black right now. Adrian, can you see us? There she is.
Better?
All right, we got you there, Adrian. Adrian, can you believe tomorrow marks 6 months since the Arnold Expo was canceled?
6 months, it honestly feels like it was years ago, which I'm sure that many people feel the same way. I don't think you could have told us 6 months ago what would have transpired over these past few months, and anybody honestly would have believed you.
So actually, when this all broke out, you had just gotten here as a new reporter. You had not been here this long, and you were kind of really thrown into all of this. What was that like for you, I guess, kind of personally? And then for many days, your day was 2 o'clock. Governor DeWine getting the most important information, basically in the state out to the people of Central Ohio.
Yeah, I mean, obviously, I would say that starting a new job and having a pandemic hit, which many people in America probably had the same experience, is not ideal. At the same time, I think when I came to Columbus, I definitely wanted to be giving the most important information, the life-saving information to Ohioans. Obviously, I have quite a few friends and family in the area who were watching those press conferences. So at the same time, it was everything I came here for. Obviously, those 2 o'clock press conferences became a staple for everyone. I know many people who were at home during the shutdown who said that that was their 2 o'clock. Wine with DeWine became quite the slogan
Yeah.
there. And I think a lot of people were just waiting every single day and kind of sitting on the edge of their seat to find out this information, whether it be from Governor DeWine, the Lieutenant Governor, and then obviously Dr. Amy Acton as well.
Mm-hmm. Adrian, things really evolved very quickly. I remember being in one of the very first press conferences, and it was kind of business as usual. We were sitting there in one of the side rooms, right next to each other, something that we haven't done for a while. And then it evolved, and during at remote locations. Was that a challenge for you? Kind of like a different way of reporting and doing the news. We're all very proficient at Zoom at this point.
You would think so, but I still have my Zoom technical difficulties every once in a while, and I think a lot of people do. But yeah, I mean, it's been interesting. Obviously, a lot of people's jobs have changed, and a lot of people have had to learn to kind of evolve and find a new way to doing things. And that's the same with us in the news business. And I remember at a certain point there became this kind of growing need to make sure that there weren't too many people in a room, and obviously that was right after the Arnold. And we started to look around at some of these press conferences, and we were getting very close to that number. And that was at the time that Governor DeWine ultimately decided to start doing it virtually.
Mm-hmm.
And I never thought I'd be asking a question to the governor through a TV screen.
Mm-hmm.
It was just such a surreal thing. And now that's all we do. And I'm very used to it. I haven't seen the governor in person in weeks, in quite a long time. And obviously that's not something that I necessarily thought I would be doing it as well. So.
All right, Adrian, thank you so much reporting for us there at the State House. I know you are working really hard today on other stories. We appreciate you spending some time with us today, Adrian. We'll catch up with you later.
Absolutely. Thank you.
All right. Bye, Adrian. All right, everybody. So right now I'm going to introduce you to somebody that you should know. His name is Ben Orner. He is our data journalist here at NBC4, and he makes all kinds of, hey, Ben, here on the screen right now. He is in charge of what we call our data suite, and he has been keeping things updated on our website. How did you get the idea for this data suite, and kind of show us how it works? We can actually show you your monitor right there in front of you right now and show us what's going on.
Yeah, sure. So first I'll help you know. So just go to DeWine.com and usually floating around our homepage, if you scroll down, you'll see the NBC4 Coronavirus in Ohio data suite. So the sort of inspiration or whatever for this, the reason why I decided to make it was there's a lot of data floating around with coronavirus, and some of it can be confusing, and the state has its own portal on coronavirus.ohio.gov But it's some people found it pretty confusing. There's a lot of little trinkets with it, and with this, I just decided, let's just simplify it for people, make it more user friendly. And this one is actually mobile friendly. So this link, this thing I'm about to show you will work on your phone.
Yeah,
the
let's see
States
it.
version doesn't. So scroll down. There's a lot of fine print here, and I'll get into that later. But first, I'll show it to you. So here it is. This is the desktop version. The mobile version, obviously squished for your phone. But what you can do is you'll see cases, deaths, and hospitalizations over time. And right now, this is from the beginning, January up to this hasn't been updated for today, so data from yesterday. And you can sort these county. You can choose a date range. You can even choose age ranges and even the sex of the patient, because this is all data day to day that the state releases and that we just put into this program here. So first, all data journalists know that the truth lies in the fine print, and it's all outlined here. Something that people should know, and probably do know, because it's been said by officials in the beginning, is that data from the previous 14 days is only preliminary, and that's expected to rise. So if you look at this now, these last 4 days, oh man, only 200 some cases a couple of days ago. No, the number that is reported, new cases every day, is actually, those cases have been reported over the last week or so, 2 weeks or so.
And it's just when the Department of Health gets that number. Yeah,
exactly.
I've kind of explained this to people a few times. So what you see on your screen there, whether it's on our data suite or for the Ohio Department of Health, is the most accurate curve that we can get. So let's, for example, you can see a big spike. I'll show you. Go to that big spike right there, where you can see back in, was it April? Yes, mid-April is when they tested all of the prisoners, every prisoner in the state of Ohio. So that's the date they were actually tested. The day we got those numbers may have been a day or two later than that. So if we look back at our records, you could probably see, hey, we had a huge spike on X date, but now it is backdated to be on the actual date that they were tested, therefore gives a better representation of the numbers and that curve. Right. So people have the best information. And I also think you can see that there in the deaths. If you scroll down to the deaths, the black chart right there, is that correct? So you can see towards the beginning, we were told over and over again they're only testing the sickest patients because our testing was so limited. So you can see that the number of deaths that was happening was a lot higher due to coronavirus, and now there are better ways of treatment and different things like that, as well as prevention. You can see that the death number is down some, and of course it's really low towards the end there, because we don't know everybody who has died from COVID today. So we have 11 reported deaths today. Those didn't happen today. Those happened sometime over the past 2 weeks, and we are just getting those numbers. So
that's a great explanation. So let's dive into this thing.
Yeah, let's look.
You can filter it by county. So let's say, I live in Franklin County. So you can click that only, and then these charts will change to Franklin County. So, you'll see a little bit different curves. While, the entire state may have had big spikes in other places, Franklin County has spikes in other places, and then you can see the trends. As Christine was talking about with prisoners, and you can, select all, deselect whatever. So deselect, a lot of them were in Marion County, and these are sorted by the most. So that's a nice thing. You can see which counties have the most. So Marion County, and you'll see that Marion County, because there's a large prison in Marion County, most of that, rural counties cases is, happened on April 16th.
The vast majority.
Exactly. And this is something, this is nice. You can go to any county and you can see the data for yourself. So let's just choose.
Go back to Franklin County, because you can see exactly when our bars and restaurants reopened. You can kind of see it right there in the data. I actually have the exact date Yeah, so our restaurants opened for outdoor dining on May 15th and indoor on May 21st. And does that correlate with what we're seeing there on the screen?
Yeah, so like about mid-May here,
Mm-hmm.
and then by those open up. Coronavirus typically takes up to 14 days from when you catch it to when you show symptoms. So if we go to beginning of June, then 133 and things start to creep up, and Franklin County, just like a lot of the state, saw its biggest spike of
Mhm.
of this pandemic in that sort of July.
Yeah, I just wanted to show Franklin
yeah.
County specifically because we just talked to Dr. Roberts about
Exactly.
that.
Yeah.
That's cool. What else can we do with this? So towards the beginning of the coronavirus, I know more men were contracting the virus. It's kind of evened out since then, right?
Yeah, it has evened out. So let's do, if you want to do men in Franklin County, you can do deselect everything, and then like male, and then you can see men. Since it's sort of evened out, it'll probably be the same, just considering that there are, population is half male, half female.
Mm-hmm.
But 10,000 case count for male, about 11,000 for females. And,
Okay, so it's even a little
yeah,
higher.
it's about even. There is some research out there that says that more men are more prone to die from it, so you can check that out. So let's go through some other features. Franklin County, you don't have to just choose the entire state or one county. If I wanted, the state's like two very big population, or three very big population areas, Columbus, Cleveland, and Cincinnati, and then you can choose, our three largest cities, and with a date range, you can choose either like a custom start date or end date, or there's some suggestions here if you wanted to do, the last 30 days. Obviously, what's being shown right now is throughout the whole pandemic, but since we've sort of come off of this large peak we saw in July, let's check out the last 30 days. And in the three large population centers, I mean, it's pretty even. If anything, maybe even a slight downturn until we get into like the last week or so, where data is still coming in. But yeah, you can get really specific with dates. You can do one day, you can do a certain week, anything you want. And then the last things you can filter by age range. So one thing in the beginning, a lot of the people who were getting coronavirus were those who were most prone to it. So that's elderly folks in their 50s, 60s, 70s, mm-hmm. 80s. But since the summer, when things started to open up and people finally got the message that like, hey, maybe the safest thing is to stay inside. Mm-hmm. A lot more people in their 20s, in their 30s started to get it because they were going out to bars. Right. And they felt that it wasn't as risky for them. So if we do the entire pandemic, just do this year on the dates, and let's choose let's just use Franklin County because Ohio State may be able to illustrate this well for us. So the entire year, Franklin County, go to the age range. So let's deselect everything, and then let's choose, people who are considered elderly, 60s, 70s, 80s. Mm-hmm. And you can see that a lot of those people who got it, that's back in the spring, back when this was still new, when we were still learning things. Things were very closed. But if we go to maybe people in their 20s and 30s, you're going to see a spike.
Wow.
In summer because, as what we've reported, what people have experienced when things started to open up, people who were younger, who were less prone to the more severe complications to this, mm-hmm. they decided to go out. So that's something, if you have that's what we call in data journalism questioning the data, and you can find storylines in these things. And this,
yeah, of course,
one of them, and obviously we have this sex thing. And one last thing, and one thing I will show you, just how dangerous this is. It's dangerous to everybody because if you get this, there can be lasting effects no matter your age. But mm-hmm. the deaths, the very severe effects, they affect more elderly folks. Look at this: Franklin County, the entire pandemic, people in their 20s and 30s, almost 10,000 cases, but only nine deaths.
That's very fractional.
Yeah, and if you go to the bottom, if you want to use your entire screen, you can go full screen on this thing, and it can give you, just even an even clearer picture. So,
but then, okay, so show us one more time. So,
Sure.
so you have the case counts of almost 10,000, the 9 deaths, and that's in people in their 20s. Go back to
Right.
that elderly population
Yeah.
and get me a similar number to that 10,000 if we can do that.
Yeah, so entire pandemic, Franklin County, let's do people who are like the very most at risk, and we'll choose people in their 70s and 80s. So you're going to see less cases because those folks, like, they know they're at the most risk. They're going to they're going to stay inside. But even the ones who do, they're going to, far more than folks in their 20s or 30s, they're going to experience severe complications leading to death. And you see that, 9 deaths compared to 423, even with, a fifth of the cases, because they're staying inside, they're still dying.
Yeah.
So, and that it's just a good illustration of how
I don't like those odds for my grandmother, my mother. You know what I mean?
Exactly. So, and this is a good illustration of the severity of this pandemic, just how severe it is, and also like how it plays out in different age groups, and also, as schools reopen.
And then like we were talking about with the governor,
Right.
He said he was talking to Dr. Christina Johnson from Ohio State, talking about fall break, and their kids are they're not in a bubble per se, but they're not hanging out with their parents, grandparents, older aunts and uncles as much, but they are getting it at a much higher rate,
right,
at this point.
And that's why schools are more hesitant to reopen, because sure, kids get it at a far less rate than adults and older adults.
I don't know, but you had plenty of teachers over the age of 50, 60.
Exactly, and those kids, a lot of them have elderly caregivers, and they don't want to risk bringing that home. So yeah, it's something that you can find in the data.
Definitely something that our health officials and the governor are really trying hard to balance out right now, because like Dr. Roberts said, the best place for kids is school, in the classroom with their teachers, but definitely something to think about and to balance out. Ben, thanks so much for being with us today. We really appreciate it. All right, everybody, we're going to wrap up just a few minutes from now. If you missed any part of this and want to watch it from the beginning, I will clip it and put the entire thing on our website, NBC4i.com. First at 4 starts here in about an hour and 15 minutes, so we will see you on the broadcast side of things then. Thanks so much for watching. Bye.